Hello everybody, my name is Desiree. I'm the nurse practitioner at Calla Slimspa. I work alongside Dr. Gail in taking care of our patients and helping them on their weight loss journey. So today we're going to talk about losing 10 to 20 pounds and what does that benefit look like for majority of patients. Well, the first thing is going to be that you're going to lower your LDLs by up to 10%. Lowering your LDLs is going to help reduce your risk of a heart attack, ischemic stroke. It's also going to lower the blood pressure. And when you imagine your body, you have a tube where your blood flows through. Then you can have plaque buildup, which is caused from LDL. That narrows down those little vessels and makes more pressure have to go through there, and sometimes the plaque falls off and it floats through the system. Once it starts floating, it can go to the brain, it can go to your heart, which is what causes those types of issues. Now, for the blood pressure, additional pressure in the vessels raises blood pressure. So, in the end, it comes to the kidneys. So, losing that inadvertently can help your kidney health too. Another aspect of the benefits of losing just that 10 to 20 pounds is going to be improved visceral fat. You're going to lower your visceral fat, which in return lowers inflammation in your body. Once you lower inflammation in your body, you may notice that there's less swelling, less aches and pains that you may experience. So another aspect is going to be your osteoarthritis. Patients with osteoarthritis have chronic pain. So if you can take some weight off, that's going to decrease the amount of pressure and weight on those little joints. For every pound that you take off, it's like 3 pounds off of your joints. So losing 10 pounds is like taking 30 pounds off of your knee joints, which is significant, especially for those people that do have chronic knee problems. Now, you also can improve the way that you sleep. It's going to decrease the amount of obstructive sleep apnea, and that's caused from inflammation and like tissue buildup around your windpipe. So when you lay down, that pressure goes against it, causing me to wake up, causing me to snore, causing all those bad effects which disturb your sleep. So what are the benefits of sleep? You'll hear us here at Calla Slimspa always talk about all of these wonderful benefits. So when you're sleeping, which is why it's important, the hormone that helps you actually lose weight is produced during that sleeping time, and that's the leptin. So if you're getting your leptin produced, now that also has assistance in weight loss. Also, you're restful sleeping. So the cortisol now is going to come down too in your body. Cortisol, as you know, is a steroid. It also can cause inflammation and swelling. So now you've improved that too. Now, the liver, of course, if we eat fatty foods, we're going to get potentially a fatty liver. So taking 10 to 20 pounds off improves your liver health. It allows it to actually work the way it's supposed to work and helps clean out toxins. It's going to help with lowering, of course, your blood pressure and cholesterol with that aspect. And the best benefit is the energy. You'll feel so much better because the liver is now removing those toxins out of your life and helping you feel less slaggy and now have more energy. It's also going to reduce your risk of type 2 diabetes, allowing your body now to have a better insulin response. Now, there's also research that proves, that obesity increases your risk of cancer, and that's due to the fat cells that actually become active, causing active hormones that are known to cause cancer. Gentlemen out there, the added benefit to you is that it is now going to also decrease your risk of erectile dysfunction. Think about that inflammation squeezing down on the small baby vessels in that area. If you get the inflammation down, then the vessels open up again, improving, erectile dysfunction. Lastly, which is one of my favorite ones, is the financial benefit, which seems weird, right? But potentially, you may not need your blood pressure medications anymore, your cholesterol medications, your type 2 diabetic medications. You may not need them anymore, or at least need less of them. You also won't have to see your doctor every 3 to 4 months like many patients have to, because they do have chronic illnesses that are causing them to see the physician up to 4 times a year just to monitor how their status is going. Another one is for those with osteoarthritis that are going to need knee surgeries. You took the weight off. You might not need that surgery today. You may even be able to push it out to never needing it. So surgical intervention might not even needed at this point, just with 10 to 20 pounds weight loss. I hope you all enjoyed this little information, and definitely come see us here at Calla Slimspa. Thank you.